Hi, my name's Clifford Deal. I'm a breast surgeon at Richmond Surgical. The best breast cancer is the one that never happens. And one of the things that has developed in the last few years is our ability to identify high-risk populations of women who are at high risk for the development of breast cancer, and then develop specific surveillance or risk reduction strategies to reduce your risk of breast cancer. If someone has an abnormal mammogram and a biopsy is performed and there are abnormal cells, those cells can place you at increased risk for the development of breast cancer. Most biopsies, of course, are benign, but all are not. And there is a gray area between lesions that are completely benign, those that are clearly malignant, but those that are high risk. And the presence of those high-risk lesions allows us to start a high-risk surveillance program to detect breast cancer early. It doesn't mean you need a double mastectomy. It just means that we can do high-risk surveillance to detect a breast cancer earlier. Most breast cancers are sporadic. They just happen. But about 10 to 15% of breast cancers are genetic in origin. And sometimes we can identify those breast cancers before they happen. The most common high-risk marker for breast cancer is BRCA, B-R-C-A, the breast cancer genes. There are BRCA1 and BRCA2, but there are other high-risk genetic mutations which place you at high risk. How do you know if you're at high risk for breast cancer? The first thing is be aware of your history. Your family, your parents, your sisters, grandparents. If you have a family history of breast cancer and any family history of ovarian cancer, let your physician know. This is typically your OBGYN or your family practitioner or your internist. And usually, if you have any family history of breast cancer, they will begin to go through a worksheet to determine if we can do genetic testing on you to determine whether you're a carrier of the breast cancer gene. The most important thing is to identify that you're at high risk. If you're at high risk for breast cancer, that will allow us to do certain things for you. One is risk reduction. Secondly, high-risk surveillance. Thirdly, potential treatment before breast cancer ever develops. In addition to molecular testing, we also offer genetic counseling services through our nurse practitioner, Susan Yulee, who is a genetic counselor and will review your entire family history through 2 generations to determine if you are at increased risk of breast cancer.